Okay, I have my mask on as I'm entering the room. I'm going to do 20 seconds of hand hygiene. Hi, my name is Catherine. I'm going to be your nurse for today. Today I'm going to be inserting your urinary catheter. Have you had this procedure done for you before? You haven't? Okay, that's okay. I'm just going to be explaining the procedure as I go along. So before we start, can I get your full name and date of birth? Okay, Donna Santiago, January 9, 2003. I'm just going to check your wristband to make sure everything matches, okay? Okay, let me scan your wristband as well. Okay, I see everything matches. I don't see an allergy wristband. Can you tell me if you have any allergies? No allergies? And are you feeling any sort of pain today? No pain? Okay, awesome. I'm just going to start with the procedure, okay? So what I'm doing today is a urinary catheter insertion, and I understand that you're having discomfort in your bladder and you're unable to urinate. That's why your doctor ordered for the urinary insertion or urinary catheter insertion. So what I'm going to be doing first, I'm going to be cleaning your genital area. After that, I'm going to be inserting your catheter with some lubricant. After that, I'm going to be inflating a balloon with sterile saline to keep the catheter in place in your bladder. After that, I'm going to be attaching it to a stat lock that's going to go on your thigh. So if you need to move around, it'll just keep the catheter in place. Then I'm going to take a urine sample and then I'm going to send it into the lab so they can do a urinalysis. That should be all for the procedure. Do you have any questions or concerns? No questions? Okay, I'm just going to go ahead and start. I'm going to do 20 seconds of hand hygiene. I'm going to put my gloves on. Okay, this should be a fairly painless procedure, but you might feel a little discomfort. If you feel any pain, please tell me right away. I'm going to close your curtain for privacy, and I'm going to have you lay down in a supine position. You already are, so we're good to go. Okay, first thing I'm going to do, I'm going to clean the table for 30 seconds. Okay, how's your stay at the hospital been? Good, that's good to hear. Has any family visited at all? They have? Good. Okay, now that I've cleaned the table for 30 seconds, I'm going to let that air dry for 2 minutes. Okay, now that it's air dry for 2 minutes, I'm going to take my gloves off. I'm going to do hand hygiene for 20 seconds. Okay, I'm going to put my gloves on. Okay, Ms. Santiago, I'm going to start cleaning your genital area, okay? So first things first, I want to give you a warming blanket because your lower half is going to be exposed for a majority of the procedure. So I want to keep you warm. I'm just going to leave it right here for you, okay? Right. Then I'm going to have to reposition you, so I'm going to have to lift your blanket up. Is that okay? Okay, thank you very much. Okay, I want your legs in a sort of froggy position, so I want your legs sort of bent outwards. I'm going to help you with that. I'm going to do it right here for you. Okay, then I'm going to place the chucks right underneath you. Okay, I'm going to start cleaning your genital area now. Is it okay if I lift your gown? Yes, thank you very much. All right. So I'm going to take one piece of cloth. I'm going to go straight down the middle. All right, another one I'm doing on the side. And then one on the other side as well. Okay, now I've cleaned it. I'm going to lower your gown so I can prepare the rest of my material. I'm going to leave this cleaning supplies over here. I'm going to dispose of my gloves. Do 20 seconds of hand hygiene. Okay. All right, for your kit, I have your fully catheter kit. I have a syringe to collect your urine. Then I have an alcohol swab and then your stat lock. Okay. Let's start getting the stat lock open or the catheter open. Make sure you don't touch the sterile field inside. Okay, Miss Santiago, I'm just going to put this sterile drape right beneath you. Make sure I only touch the 1-inch border. There you go. Okay. So I'm going to take hold of this. Take these sterile gloves out. There you go. Okay, I'm just going to readjust this so slightly. There you go. Okay. I'm going to put the stat lock in. I'm going to put the syringe in. Okay. I'm going to put the alcohol swab in. Make sure I don't touch it. Okay. Alright, everything's in. I'm going to take my gloves off and I'm going to put some. Before I take my gloves off, I'm just going to lift the gown up one more time. Is that okay? Okay, thank you, Ms. Santiago. Take my gloves off. Do hand sanitization for 20 seconds. Okay. I'm going to put my sterile gloves on. Okay, sterile gloves are on. Dispose of that. Okay, I'm going to get ready, prepare the rest of my kit. Okay, so I have the urine collecting bottle. I'm going to slightly open it. I'm going to leave it right here. Okay, then I have the lubricant, the sterile saline, and then I have the swab sticks. Okay, I'm going to discard the tray. Okay, I'm going to put this into the orange port. Okay. Then I'm going to remove the sheath of the catheter. Okay, I'm going to put the lubricant on. Okay, then I'm going to put the iodine swabs right here. Okay, I'm done preparing my kit. I'm going to bring it over now, Ms. Santiago. Okay, I'm going to leave it right here. Okay, Ms. Santiago, I'm going to start by cleaning your labia. So I'm going to use my non-dominant hand to just open your labia like that. Okay, I'm going to clean the middle. I'm going to clean the side right here. I'm going to clean the other side as well. Okay, I'm going to dispose of these packaging. Okay, Ms. Santiago, I'm ready to insert the catheter. Okay, I'm going to have you take a deep breath. Then I'm going to have you, when I count to 3, I'm going to have you exhale on 3 as I insert the catheter. Okay, ready? So I'm going to count to 3. So take a deep breath. 1, 2, 3. Okay, I see some urine flashback. I'm going to insert it in 1 to 2 inches deeper. Okay, I'm going to stabilize it here. I'm going to take my non-dominant hand and insert the saline. Okay, I'm going to leave the syringe here just in case. I'm going to test for resistance. Please tell me if you feel any pain. Okay, I feel resistance. You feel any pain? No pain? Awesome. Okay, I'm going to let go of that. I'm going to dispose of the syringe. I'm going to dispose of the lubricant since we don't need it anymore. Alright, I'm then going to collect some urine. So I'm going to use my dominant hand, get the CHG wipe, and I'm going to clean the ports right here. Clean it for at least 5 seconds. 1, 2, 3, 4, 5. Let it air dry for 5 seconds. Okay. Then I'm gonna take my right hand. I'm gonna get the syringe here. I'm gonna collect at least 5 milliliters, so 5 to 10 milliliters. Okay. There you go. I'm gonna leave this on the field. Right. Then I'm going to get the stat lock. So first I'm getting the skin prep, and I'm cleaning the area on your thigh. Okay. Then I'm going to get the stat lock, attach this. Okay, and then I'm going to attach it to your thigh. Okay, Miss Santiago, we're almost done. Okay, I'm going to attach, this is on your leg. I'm going to attach the collecting bag to the side of your bed. Make sure it's not on the railing, but the bed itself. Okay, have any questions, Miss Santiago? No questions? Any pain? No pain? Awesome. Okay, I'm going to dispose of everything since we're done. Dispose of the drape as well. Okay, I'm going to reposition your legs. There we go. Okay, I'm going to pull your gown down. How are you feeling, Miss Santiago? Okay? Good. Okay, I'm going to remove my gloves. Need 20 seconds of hand hygiene. I'm going to put my other gloves on. So I'm just going to be putting your urine sample into this collection bottle. Okay. Alright, so I'm just going to make sure the side of the syringe doesn't touch the side of the bottles. Okay, it's all in. I'm going to dispose of this. Okay, close this carefully. Enter the patient's full name and date of birth, the date and time of the procedure, and the patient's MRI number. I'm going to put this here for later. Dispose of all of this. Okay, I'm going to dispose of my gloves as well. 20 seconds of hand hygiene. Are you feeling okay, Miss Santiago? Okay, sounds good. Okay, we're done with the procedure. I'm just going to send your urine in later for a urinalysis. Do you have any questions or concerns? No questions? Okay, you feel like you tolerate the procedure well? Yes? Okay, good to hear. Okay, I'm going to lower your bed in the lowest position. I'm going to put your side rails up, and I'm going to put the call bell just in case you need me, okay? Other than that, I'm going to go document my procedure. And thank you so much, Ms. Santiago. Okay, I'm going to bring this with me. Okay, I'm going to document the date and time procedure. I'm going to document patient tolerance and pain level. Urine catheter size was 16, and the urine was yellow, it was clear, and had no sediment. And then I'm going to bring this to the and the urine output was 150 milliliters. And I'm going to bring the urine to the lab so they can do a urinalysis. Okay, as I enter the room, I have my mask on, and I'm going to do 20 seconds of hand hygiene. Hi, my name is Catherine. I'm going to be your nurse for today. Today I'm going to be doing your Foley catheter removal. Have you had this procedure done for you before? You haven't? Okay, that's all right. I'm just going to be instructing and telling you what I'm doing as I go along. Hey, before we get started, can I get your full name and date of birth? Hey, Donna Santiago, January 9, 2003. Okay, I'm just going to check your wristband to make sure everything matches, okay? Okay, I see everything matches, and I see you don't have an allergy wristband. Do you have any allergies, Miss Santiago? No allergies? Okay, are you feeling any sort of pain today? No pain? Okay, awesome. I'm just going to go ahead and explain the procedure for you, okay? So today, your doctor ordered that your urinary catheter to be removed. You're able to urinate on your own now. So what I'm going to be doing is first, I'm going to be removing the stat lock that is on your thigh. I'm going to use an alcohol swab to just remove that. Then after that, I'm going to be taking a syringe. I'm going to be removing the fluid or the saline that is keeping the catheter in place in your bladder. After that, I'm going to instruct you to take a deep breath. And on the count of 3, I'm going to remove it as you exhale. After that, I'm going to take collecting bag, and I'm going to measure the urine output with a graduated cylinder. I'll come back and I'll explain to you what you need to do for the next few times you void, okay? All right, do you have any questions or concerns before I move on? No questions? Okay, awesome. All right, before I get started, I'm just going to close your curtain for privacy, and then I'm going to have you laid in a supine position. You already are, so we're good to go. All right, I'm going to do 20 seconds of hand hygiene. Some gloves on. This should be a fairly painless procedure, Ms. Santiago, but you might feel a little discomfort. If you do feel any pain, please tell me right away, okay? All right, I'm gonna reposition you, so in order to do that, I need to lift your blanket up. Is that okay? Okay, thank you very much. All right, I just need your one leg to sort of go in a frog position. I just need the leg bent, so I'm gonna help you out with that, just like this. Okay, thank you very much. Then I'm gonna put the chucks right underneath you. Okay, there you go. Okay. Then I'm going to remove my gloves so I can get my materials ready. 20 seconds of hand hygiene. Okay, I'm going to open my 10 milliliter syringe. I'm going to take the alcohol swab. Okay, I'm going to swab the stat lock off. Okay, then I'm going to take this off. Okay, Ms. Santiago, I'm going to have to lift up your gown. Is that okay? Okay, thank you very much. All right, I'm going to take the syringe. I'm going to remove some fluid. Okay, I'm going to leave the syringe here just in case I need to remove more fluid. Okay, Ms. Santiago, I'm going to have you have a deep breath in. Then on the count of 3, I'm going to have you exhale as I remove it, okay? Now deep breath in for me. 1, 2, 3. All right, how was that? Did you feel any pain? No pain? Awesome. Okay, the syringe, if there was any sort of resistance, I would try to remove more fluid. But if there's continued resistance, I would leave it in and I would call the provider right away. Other than that, I'm going to throw the syringe away. I'm going to wrap this catheter in the chucks. Okay. Okay, Ms. Santiago, I'm just going to go to the bathroom. I'm going to dispose, or I'm going to measure the urine output, then dispose of it. I'm going to lower your gown and maintain your privacy. There you go. I'll be right back, Ms. Santiago. Okay, everything looks good. Your urine output was about 50 milliliters. I'm going to reposition your leg. There we go. Okay, I'm going to lower your gown now. Hey, how's the procedure? Did you feel any pain? No pain? Okay. Did you feel like you tolerated the procedure well? You did? Awesome. Okay, I'm going to do 20 seconds of hand hygiene. Now I need to tell you what you need to do. So next few times you urinate, I need you to use the call bell so that I can come. I need to measure the urine output as well as the characteristics the next 2 times you urinate. Then after that, you may feel some burning, but that is completely normal. It should go away after a few more times of urinating. But if you still feel any sort of pain, burning, incontinence, or even bleeding, please tell me right away and use the call bell so I kind of come assess your bladder as well as your genital area, and I'm going to call your doctor as well, okay? Other than that, do you have any more questions for me? No questions? Awesome. Okay, I'm going to lower your bed to the lowest position. I'm going to put the side rails up. I'm going to put the call bell right next to your bed when you do need to urinate. Other than that, that should be it. Thank you so much, Ms. Santiago. I'm gonna go and document everything, okay? I'll see you later. Okay, 20 seconds of hand hygiene. I'm gonna document the patient's date and time of the procedure, their tolerance to the procedure as well as their pain level. Urine output was 50 milliliters and their urine was yellow, clear, and had no sediment. I'm gonna make sure I document the next 2 times the patient calls me to urinate as well.